HIV, human immunodeficiency virus, and the resulting AIDS, acquired immunodeficiency syndrome, have caused around 35 million deaths since their discovery in the early 80s. Therefore, they're a global health concern. It's estimated that there are around 37 million people living with HIV today. In 2017, around 1.8 million people got newly infected, and 1 million adults died from HIV. The overall number of infected people is stable, but the burden of disease is still high because although the number of new infections and deaths are decreasing, life expectancy is increasing. Anyone can get infected with HIV, but sex workers and their clients, men who have sex with men, and people who inject drugs are more susceptible to infection and are represented disproportionately. So how does it get transmitted? There are 5 bodily fluids, semen, pre-ejaculate, vaginal secretions, blood, and breast milk, that contain enough of the virus for it to be passed on. There are 4 openings in the body, or simply put, doors, that allow a fluid to transmit HIV. These are the tip of the penis, vagina, anus, and open wounds. Both a fluid and a door are needed for transmission to occur. Therefore, it happens through vaginal and anal sexual intercourse, especially in the receiving partner, from mother to child in the womb, during birth or breastfeeding, and blood to blood is also possible, through contaminated blood products or needles. When HIV enters the human body, it binds to CD4 molecules found on immune cells called CD4 cells. This causes fusion of the virus and cell, allowing HIV to gain access into it. Inside the cell, viral RNA is converted to DNA. This process often leads to mutations creating different strands of HIV. Then the viral DNA is integrated into the cell's DNA. When the cell becomes activated, it triggers protein synthesis as part of the immune response. But because the viral DNA is inside the person's DNA, this creates viral components which are assembled together, creating a new virus that goes off to infect another cell. The cell can only take so much viral replication until it dies. This process repeats over and over, but until now the person has no symptoms. This is the incubation period and lasts for about 2 to 4 weeks. Eventually, the person's immune system gets activated, leading to CD4 cells being recruited, but subsequently depleted as HIV destroys them. It also causes production of a protein called antibody against HIV. This is called seroconversion. However, it's poorly functional as there are so many types of HIV from the mutations. During this, most people experience a few weeks of mild, vague symptoms, like fever and fatigue. This is called primary illness. Eventually, the body's counterattack dampens HIV, which remains hidden in dormant cells. Again, the person has no symptoms. This is the clinical latency stage and lasts for around 10 years, during which the virus slowly replicates and kills cells. Eventually, cell numbers drop so low that the person becomes immunocompromised, which means their immune system can no longer fight off infections it should. First, the person contracts HIV-related conditions and then AIDS-defining conditions, at which stage the person is diagnosed with AIDS. These affect the brain, eyes, digestive tract, blood, lungs, heart, kidneys, and skin. In this stage, people experience various symptoms, collectively called a syndrome, and if untreated, they die. Unfortunately, there's no cure for HIV yet, but to slow disease progression, medication called antiretroviral therapy is used. There are various drugs that act on different parts of the viral life cycle: here, 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 and here. Currently, a combination of 3 drugs is recommended. Previously, only people who had below a certain cell count were put on ART, but now everyone should get it when diagnosed, based on a study which showed significant benefits to early treatment in a broad population of HIV patients. Challenges with ART are that it has to be taken forever, it has side effects, and you have to strictly stick to the treatment regime for it to work. To prevent HIV transmission, biomedical, behavioral, and structural interventions are recommended. In terms of biomedical interventions, having HIV patients on ART is effective because it suppresses the virus, lowering the risk of transmission significantly. This is called treatment as prevention. To do this, we need to be able to identify people with HIV, initiate ART in them, and maintain them to suppress their viral load. For this, community-based and self-testing, simultaneously receiving counseling and ART instead of one before the other, and ART treatment support are recommended. Pre-exposure prophylaxis is using ART to prevent people in high-risk groups from getting HIV. This has been shown to be hugely effective, but problems are funding and long-term safety. Post-exposure prophylaxis is when ART is taken after potential exposure to HIV, but there's limited direct evidence for its effectiveness as it's unethical to test. To minimize the risk of mother-to-child transmission, use of ART, screening, cesarean sections, and bottle feeding are recommended. Condoms are effective but require partners' consent and therefore a discussion about sex. Male circumcision has shown to decrease transmission significantly and is good because it's a one-off and doesn't require behavior change. But it's expensive and only protects men from getting infected. A vaccine and microbicides are in development. Another way to approach prevention is through encouraging behavior change. Safer sexual behavior has been promoted with the iBSc campaign, but is proven ineffective as in many countries, sex is a taboo subject and women have poor control over sex. Other ways to influence behavior change has been through encouraging regular HIV testing and adherence to biomedical interventions. Lastly, structural changes in laws can promote change in cultural and social norms, such as HIV stigma. Decriminalization of homosexuality, sex work, and providing needle exchange programs could help key populations access the support they need. Decreasing gender and economic inequality and increasing access to health services have great potential too.